Recent studies have revealed that the leading cause of injury, morbidity in U.S. hospitals is, in fact, and you may be surprised by this, medical negligence. The one thing most people don't know about is that we are also one of the countries where it's most dangerous to deliver a child. And we are, unfortunately, we shouldn't be, unfortunately, too proud of this. One of the things that happens routinely in our hospitals is there are circumstances where deliveries are not timely performed and conditions are not timely managed in pregnant women. As a result of this, we have, unfortunately, again, a very large population in this country of patients with cerebral palsy, sometimes referred to as CP, or brain injury, which is what this condition is. A lot of parents, unfortunately, will not recognize that their child may be affected by this condition because it takes time as the baby matures for the signs and symptoms of this condition to evolve and manifest themselves. Sometimes, according to some literature, it takes up to 7 to 10 years before a pediatrician will be in a position to make the diagnosis. Unfortunately, you as the parent don't have the luxury of 7 to 10 years because, again, you have to prepare for the worst while you hope for the best, and you must act with legal action in cases like this while the evidence is still fresh, while the recollection of people and witnesses is still intact. You want to act before a pediatrician is willing to give you a diagnosis of cerebral palsy a decade later. And so what do you do as a parent when you have that situation where you think something went wrong and you think your child is somehow different than other children? Well, the first thing you want to do is make sure that you address that issue with your pediatrician and that you ask for tests and evaluations that are targeted to elicit information about cerebral palsy. What you're looking for is your child having difficulty speaking? Is your child acting erratically? Do you think your child has developmental delays? Do you think your child is acting in a way that is not commensurate with his or her age? Those are the starting symptoms you want to look at. The other thing you want to ask yourself is, how was your experience in the labor and delivery unit? Was it a normal experience where things went as planned, or was it erratic and stressful and delayed in ways that bother you? Ask yourself, how long was I in labor? Ask yourself, how long did it take them to bring me to the operating room after making a decision to perform a cesarean section? What was your baby's blood gas when the baby was born? And what was your baby's APGARs, scores that are given at the time of delivery to indicate the baby's viability? If the answer to those questions is worrisome to you, you must act now. Again, don't wait for the pediatrician to give you that diagnosis when it could be too late. You want to call someone at Gilman Bedigian today, ask about representation, ask us to engage in an investigation on your behalf so we can make sure you have the best chance of winning when your case is ready for trial. There's no expense to you. Let's say you don't act right away, and now 12, 14 years later, you get a diagnosis from a pediatrician that tells you your child has developmental delays, attention deficit disorder, cerebral palsy, mental retardation, or a condition that is similar. What do you do then? Some people will say, well, that was too long ago and there's nothing I can do right now. It's not the case in Maryland. Cases that that involve children, regardless of the type of injury, are ones in which you can have a much longer statute of limitations. Because in Maryland, in order to bring an action, you should do it within 3 years of the date of majority, which is 18 years of age. So in essence, in many instances, there are many more years to bring a legal action in order to ensure that your loved one is taken care of. Again, if you have any questions about this, we deal with these issues routinely. We would be happy to answer that question if you call. Make sure to call today. We operate on a contingency fee agreement, and we will be happy to assist you.